Welcome to the National Rural Health Executive Webinar Series. My name is Colleen Bay with NRHA Services Corps. I have just a few housekeeping notes to review before we start. Everyone will be muted throughout the duration of the webinar. If you have a question at any time for either one of the presenters, just go ahead and type it into your control panel and we'll make sure that it gets covered at the very end. And we're going to try to get through this webinar in about 30 to 45 minutes, offering time at the very end to cover all of those questions. As a reminder, this activity is being recorded and you will receive a link to the recording before the end of the day. Today we have two presenters, Beth Brand and Dana Beaver-Lewis. Beth has over 30 years of invaluable experience in healthcare industry that ranges from critical care nursing, clinical informatics, and decision support to product expertise. At MorCare, she provides extensive leadership and guidance to both customers and the MorCare team. Prior to joining MorCare, Beth was a longtime customer at the Indiana University Health, where she was the Director of Clinical Decision Support for the health system. Dana also has been in healthcare for over 30 years, wearing multiple hats, including working as a frontline case manager and quality reviewer. Now, Dana is a Senior Clinical Solutions Consultant for MorCare. I'd also like to take this opportunity to thank MorCare for taking the time today to put on this presentation. They have entered into the NRHA Partnership Program in 2019, and we appreciate the support of our mission and for the industry expertise that they bring to our rural hospitals and clinics. With that, I'm now going to turn it over to Beth for our feature presentation, Invest in Automation Now to Ensure Organizational Success in the Future. Beth?
Okay, thanks, Colleen, so much. Really appreciate it. And thank you all for spending time with us today. Well, it's a new year, and we at MorCare realize that many of you all are facing some really important decisions around your strategic priorities for 2022 and beyond. And some of you have the opportunity right now to make decisions about funding dollars, and there's a lot to consider. Now, historically, must admit, the departments of case management, patient safety, and quality are not thought of as revenue generating, and therefore, often we're not first in line for capital investments. But we want to challenge that thinking a little bit today. In this session, we're going to be looking at some of the areas where an automated solution can provide value for your organization. We actually even have some ROI calculators that we use to demonstrate how improving readmissions, length of stay, denials, and decreasing patient safety events can really result in significant cost savings, to say nothing, of course, about improving outcomes and saving lives. So let's start with case management, excuse me. And in thinking about this, how can an automated solution really enhance and provide value to the case management role? There are some key features to consider, such as an automated solution can allow you to perform screening using automated assessment tools. It can help you identify patients with needs that correlate to really high risk of readmission. You might not have that visibility without an automated system. It can help you search for appropriate post-discharge resources in a really time-effective manner, and making sure that you are considering all of the resources out there that might meet that patient's need. It allows you to avoid and manage payer denials, therefore optimizing revenue. Remember, denials are a sneaky little thief of revenue, and so this, by managing those denials, it will increase the bottom line. So let's start with readmissions. As we all know, readmissions are often reflections of the overall success of the first encounter for a patient, or the index encounter. How effective was the discharge planning process for that first day? Were there gaps that resulted in unnecessary readmissions? Having an automated discharge planning solution will help you ensure a more timely and a more effective discharge process. This will contribute to a lower length of stay because you can place patients with appropriate post-discharge services more efficiently, but also unnecessary readmissions are decreased because the discharge process and the handoff process to those post-acute providers, be those SNFs or home health, is more effective with fewer gaps. We encourage you to look for automated solutions where case managers' work lists display risk scores for your patients. These risk scores can come from the assessments that are being completed within that application, or they can come from scores imported from the EMR or other sources. And at MorCare, we have customers doing both. All of our customers have assessments built into our solution because that's a real strength of ours. But in addition, we have other customers who are bringing in scores that are being calculated in the EMR, and we land those in the application, and we make sure to display those on the work list. Because having the information displayed on the work list, which is the case manager's to-do list each day, will allow your staff to prioritize and focus their efforts appropriately. Discharge planning and readmission management can be improved through more timely awareness of patient need and more appropriate use of follow-up programs. And then, of course, being able to utilize the risk scores for those patients as you dig into data and analyze your populations and your outcomes is extremely valuable. We feel that screening tools, or assessments as we call them, are extremely valuable for case managers. Some examples of those that are used by almost all of our customers are the readmission risk tools. Those can be LACE, it can be Project Red, it can be something that you all have created within your organization. The important thing is to have it, to have those assessments in there and to complete them. And many of our customers are also doing social determinants of health, or SDOH assessments as well. And the reason why having an automated tool for this is that this is designed for use at the point of care to very quickly and efficiently screen your patients. It decreases the time required for care managers to record that patient-related information. A great benefit to having a screening tool is that it really improves the consistency of documentation. So you aren't relying on narrative notes from various different case managers. You're not hoping that each of your staff members remembers to ask the patient the same questions and to document appropriately. It's all laid out for you. There's a structure there, and you march along and you ensure that you're collecting all the information in a standardized manner. And another benefit to these data elements is that you can use these when analyzing your readmission. So for example, as you look back over time and you're looking and you're kind of digging into readmissions and trying to understand where the issues are, you can see how many of your patients were identified as being high risk. You can, see if there are similarities that were gleaned from those assessments in those patients who are readmitting. And effective assessment tools really don't need to be overwhelming or excessive in length. And so a lot of times people get a little paralyzed, a little worried that, we just don't have the time to develop something like this, but they can be very short. And you can certainly, there's a lot available out there in the market now that's free that you all can use and adopt into your organization. And of course, in addition to the efficiencies that a hospital gains by automating processes, equally important should be the information that will be available as a result of having these workflows automated. So it's really important to understand which patients are returning and what the reasons are for those. And that's why using a validated risk assessment score and risk stratification tools are so important. These can be built right into the workflow. And then, of course, reviewing the data via reports or dashboards are very, very important. It's important to learn about what the contributing factors are to your hospital readmissions and where you should direct your efforts. Okay, well, we have all heard the term ROI, return on investment, and I'll admit that most of the time we think of return on investment as being how much money we're making on an investment or a technology. But an equally important question is, how can we reduce costs, improve care, and maximize our resources? All of those lead to an enhanced return on investment. So we have here a representative example, and we're going to walk through this with you. And at MorCare, we use this a lot with our customers, with people who reach out to us about our solutions, and we would be really happy to meet with any of you on this webinar today and use your hospital data and really walk through a very customized ROI for you. But in the meantime, let's just look at this sample, okay, or example, I should say. So we're going to take a hospital that has a total annual discharges of about 3,600 patients, and we're going to assume that approximately 30% of those are Medicare. So the Medicare population is about 1,100. And we're going to also assume that those patients have discharge dispositions that are kind of stratified across facility placement, going home with services, and going home without services. And we're just using some kind of national averages here. Of course, this might vary with your organization, but just for the sake of an example, we're just going to use some national averages. So on average, Medicare, approximately 21, this actually is going up a little, percent of Medicare patients end up going to skilled nursing after an acute hospitalization. So that results in approximately, for this example, 238 patients go to skilled nursing. Okay, we're also going to assume some things here. Let's just assume that at your hospital, the length of stay is 4.3 days on average. And we're also assume that very conservatively that your Medicare patients also have an average length of stay of 4.3 days. I think we all know in reality that usually Medicare patients stay longer than that, but again, we'll stay conservative for this estimate. And an estimated cost to deliver the care to these patients is $2,300 a day. That doesn't mean what you charge. It doesn't mean what you bill. It doesn't mean what you're paid. It means the cost for your hospital to actually care for these patients is about $2,300 per day. And again, that's a national average that we took from the Kaiser Foundation. And then let's just say that by putting in an automated solution, an automated discharge planning solution and post-discharge placement solution, that you are able to be so much more effective in your discharge process that you can actually reduce 30-day readmissions for those patients going to facilities by 8%. That's not huge. That's pretty conservative. Those patients going home with home health services by just 5%, and likewise patients going home without services by 5%. So very conservative. If we do that, what we see is the reduction in readmissions for patients in each of these discharge dispositions. You take these readmissions times 4.3 days for each of those, so you would be saving 275 days, patient days, which would equate to a cost savings for your organization of $631,000 over the course of 1 year. So you see, when we look at it through this lens, it's pretty easy to see how investing in solutions to assist us in these workflows, it's really, it's kind of a no-brainer, quite honestly.
Okay. All right. So I'm going to talk about reducing length of stay and how can automation help reduce length of stay. Okay. You can hit the button now. Automation, it's all about being able to document online. You want to make sure that you have a system that allows you to document electronically and that the information is pushed back into the EMR. This allows for on-demand viewing by physician, nurses, and other staff involved in patient transitions. You also want to look for automation to streamline communication between hospitals and post-acute facilities. Currently, how are those referrals being communicated to post-acute? Are faxing or phone calls can cause delay in throughput. Automation can also include the use of portals where a discharge planner can communicate real time and share confident documents in one place. And all of these examples here really help prevent gaps in care, delays, and effective handoffs. And guys, I just want to let you know that I'm singing and Beth is playing the piano, so if we're a little off, we apologize.
Sorry.
Okay, managing post-acute partners effectively. So automation allows you to actually do that. It helps realize the performance of your partners. So in this example, you can see I'm looking at the disposition of my patients, but let's drill down on the SNF to see, are they meeting my expectations for turnaround time? And it's like, wow, Oak Ridge is not. Are they causing my readmission rate to go up? Absolutely. So within the rural community, there might only be maybe 2 or 3 post-acute facilities. So having this information allows me to work effectively with my partners to ensure the best experience for our patients, as well as my facility, as far as getting charged for rates, readmissions. Okay, next slide. Okay, so this next slide just highlights some interesting statistics that I wanted to share, and Beth, you can just click them all. I won't read them all, but even this top one here, medication errors during transitions, 80%. That's pretty high. Okay, 22.3% of all hospitals, all hospital discharges were to post-acute, and that percentage is going to go up due to the aging baby boomers, which I'm a part of. Okay, another one, Medicare patients are staying longer, which we already know that, but there are no additional funds. So using automation to help that throughput is just imperative. And I'll let y'all marinate on the rest of these, but that this is really happening. Okay, next slide, please. So the overall goal and of rural hospitals as well as the bigger hospitals is to improve health, lower cost, and ensure optimal outcomes. And how do we do that? We can identify vulnerable patients and target the appropriate resources, which could be, by the way, community-based. Okay, so let's not ever forget about community-based. Do you have access to view those community resources in your patient's areas? Okay, and of course, we're going to talk about the 4 rights again. You want to make sure your patient's getting the right treatment in the right setting to the right patients and at the right time. Okay, next page, please. So this is an ROI screen, and and this is the same methodology that Beth went over with you a little earlier. But in this example, we're demonstrating how an automated solution could decrease length of stay and how that could save your organization significant money. This type of cost savings would be more than offset the cost of an automated system. So you really want to look at those numbers holistically. Okay, next page. Denials. Okay, so here are some recent statistics that I'm going to share with you. Between 10 to 40%, of submitted claims are denied. And the cost of an appeal, I've actually heard is as low as $34, but then it can go high as $1.18 or 118 per claim in order to work that denial. And so, as you can see, denials are very, very costly, and you can see that it can cost some health systems up to 2% of their net revenue. So the next slide is going to kind of outline what we've already discussed. I'm a visual person, so we're really going to break this down. So let's assume that according to statistics, your payers are denying approximately 20% of claims submitted. And the cost to your organization to work those denials, approximately $118 per denial. If you submit 7,000 claims in 1 year and 20% are denied, that equates to 1,400 denials. At a cost of $118 each, the overall cost to your hospital is approximately $165,000 in 1 year. And that doesn't even include the amount of revenue you lose if denials are not overturned. So this visual really, I'm sure can resonate with all of us on the webinar. Okay, next slide. So one thing I do want to mention, denials are going to occur in hospitals, just like falls will always occur in hospitals. However, if we can identify ways to prevent preventable denials, like we try to prevent preventable falls, we're ahead of the game. Okay, so some things that you can do is ensure that the EMR correctly reflects the care of what's being given to the patient. Okay, and that's warm bodies monitoring this, your case managers, your social workers, following up on these patients to make sure that they are in the right setting, because that is low-hanging fruit of a denial. Okay, you also want to ensure that the clinical you also want to ensure that the clinical provided to the payer at the right time as well. So does your system notify you when it's time for you to contact the payer? Does it notify you if the insurance has changed? I'm leaving messages with Blue Cross Blue Shield, but meanwhile, the patient's insurance is actually Aetna. Okay. How are you notified when it's time, again, for you to get additional days? So you want to ensure that those items are being handled, because that's self-assured technical denial. Again, low-hanging fruit. And lastly, again, ensure that the care is being provided is appropriate with the level of care that your patient is in. And you want to make sure that you have a tool that can help with those denial preventions. Okay. Next slide. Technology. Technology can play a key role in curbing denials. but not only managing the denial process, but truly avoiding denials from occurring in the first place. Okay, we've identified that many hospitals, including rural hospitals, are still using outdated processes or patient-based workflows for denial management. But given the fact that denials on the rise, it's really important to have the right tools and process to manage your patients. This not only results in better management of denials, but in denial avoidance. For example, your caseload or your work list should not only show the current length of stay of your patients, but also show the number of authorized days. That would help you to, at a glance, identify any discrepancies or gaps in that process, which can lead to a technical denial. And I guess just to wrap it up, you want to think about this as being an investment in the future financial health of your hospital. Okay, so the next slide is just a quick ROI. And this pretty much is just identifying that if you decrease your denials, you will increase your revenue. So if we assume that your organization recently experienced approximately, let's say, $150,000 in denials each year, and if approximately 60% of those denials are categorized as medical necessity issues, this demonstrates how using an automated denial management solution to improve your process. Okay, it's just apples and oranges here. It really shows that in a period of just 3 years, the savings on medical necessity denials could be significant, and this could result in a sizable savings for your organization. And one of the things I want to mention about this is that a lot of organizations don't know what type of denials that they're getting. That's so important, so you know where to put your efforts. Are they in utilization review? Are they administrative? Okay, so that's something also that a system can do for you to identify the type of denial so that you can begin to rectify the processes around those. Okay, next slide, please. Oh, this is for you, Beth,
Okay.
improving patient
Yes,
safety.
I'll let you rest your voice for a minute, Tana.
Thank you.
Bless her heart. She's just recovering from bronchitis, and she's you're brave to, to take this on today.
Okay.
Well, we know that given, let me just ask a couple questions. What if your leadership could articulate the primary patient safety issues within your organization? And what if you were confident that patient incidents were being reported and shared appropriately? And what if you had the information that you need to improve patient safety in your organization? Sounds good, right? Well, we know that given the right solutions, these are all possible, and your organization can be empowered to make some meaningful improvements in patient safety. Incident reporting systems are well known, and it's well published that they're like a cornerstone of patient safety. The advantages to having an electronic system for incident reporting is that they provide structure and consistency in the information that's being reported. Again, similar to what we talked about with assessments, but I very well remember the days when incidents were reported as just long narratives, right? Written on papers, turned into supervisors. I guess that shows how old I am. But anyway, it's so much more important to have a form where all the different data elements that you need to collect are right there, and people can just walk through, and you ensure that you're getting a consistent and complete report. Also, the accessibility, easily accessible for to all staff members. Much different from before, again, when manual forms were utilized and then they had to be turned in to the supervisor. It's kind of intimidating. Oftentimes people wouldn't report because of that. Easier to submit with fewer barriers, as I just said. We want to encourage reporting. As you guys know, incident reporting, patient safety is kind of counterintuitive in that we want to have more things reported. So it's kind of good to have more incidents documented in your system, because it says that people are paying attention, and I really value a culture of safety, and they really want to communicate when something goes wrong for the patient. Also, an automated system allows for easy referral and input from other departments involved. It broadens the perspective. So if something happens to an inpatient down in X-ray, that can very easily be shared with the manager of the nursing unit where the patient resides. And so there can be, the sharing of information and perspective, and having others weigh in is just invaluable. And then again, Information about incidents and therefore the lessons that are learned can be shared with the organization. And in all of these ways, incident reporting systems are contributing to improving our patient safety culture. And change is a super important component in patient safety and risk management. Reporting the incidents alone is really not enough. There is a need for action so that we prevent future incidents from occurring. A lot of time is spent in hospitals across the country reporting incidents, but often that leaves little time for real improvement. In many cases, a gap exists between the culture of safety that the hospital values and wants, and yet how the hospital is actually using data to understand patient harm and what to do about it. So think of it this way: we need to learn from what went wrong instead of just reporting that something went wrong again. We need to improve our feedback mechanisms. And we need to let people know that, we appreciate them reporting these, that we're doing things, that we're taking actions, that the time and effort that they took to report an incident is truly valued and is going to help make things better. And then we often see that data exists, but there's no follow through with improvement initiatives based upon that data. And unfortunately, what we all know is that if changes aren't implemented and recognized in the organization, very soon the motivation to continue reporting will decrease. It's also really important to understand how patient safety improvements support value-based care. With the transition away from fee-for-service to value-based reimbursement, the importance of patient safety now extends beyond just making things better for the patient's welfare to now it's also impacting a hospital's financial bottom line. And as we all know, reimbursement is now being tied to patient safety. The government's penalizing hospitals and withholding reimbursement based upon the number of hospital-acquired complications or events that occur. Patient safety has always made sense as the right thing to do because it's based on caring and compassion for the patients, but providing safe patient care also provides cost savings to the hospital. So now is the time for risk managers out there to demonstrate how an automated patient safety solution will both support improvements in patient safety and result in added value to the hospital. So that leads us to calculating an ROI for risk management and patient safety programs. And a good place to start in doing that is to understand the cost of adverse events to your organization. So what you see here is a great tool that was created by AHRQ, which is the Agency for Healthcare Research and Quality. It's a great organization. And they put this together to help hospitals quantify the cost of adverse events or healthcare acquired conditions. And you will note that for the major events, they have listed here an average cost range per event. You'll see that those ranges are wide, they're broad, and that's because of the fact that the impact or the harm can really vary between events or between patients. But at least it's a way to begin to approximate the current cost of your organization. So you can get this tool online at AHRQ, and then the idea is that you can plug in the number of events in each of these categories that's occurring at your facility, and then it will calculate your facility's average cost. So we decided to do a very skinny down version of this as an example for you all. So we took for an average facility with approximately 2,500 admissions per year, using the AHRQ data, we looked at med errors, falls, and pressure ulcers. And so for med errors, we took the low end of the cost range for each of these, again, to be conservative. So for med errors, we said it cost the organization $1,000 per med error, and the national rate, as published per AHRQ, is about 1.2 per 100 admissions. So if we apply that to our demo facility of 2,500 admissions, the cost in 1 year, you can see, adds up pretty quickly in just looking at these three categories of incidents. So you can very quickly get to an incredible cost to the organization, much more than offsets the cost of a patient safety automated solution. And then, of course, we as you hear us here, we love the use of data. We love analytics. It's something that we feel very, very strongly about. It's very important to capture those patient safety events as they occur, but it's equally important to analyze and use that information to make change. Whatever solution you're using, it should be able to provide you with up-to-date, easily accessible information about the incidents or events occurring in your hospital. So in this example, we're just going to use one of our MorCare dashboards for risk management. And you'll see here it's pretty simple. It looks at the trends of incidents, and this is demo data, by the way. It looks at the major incident types, and we believe in a Pareto display because it really focuses you on, the 20% that are causing the 80% of your events within your organization. We also we stratify those across severity level, across location, and each of these cases you can drill down and learn more. So if I want to learn more about medications, my medication errors, I can very quickly see what type of delineations we had within that med error category, what specific types of med errors were occurring. Was it the wrong medication given? Was it the dose incorrect, et cetera, et cetera. It also allows me to see at a glance for my med errors during this time period, what were the contributing factors that were contributing to this error. For example, was a procedure not followed and therefore we had a miss? Was there a communication failure, et cetera. I can also then drill down again and into any one of these delineations and look further at the patients who were impacted. And that allows me to then bring in my any comments that were attached to the incident, and I can really get a full view of what was going on. So that's just an example of how analytics allows you to drill in, dig in, and really understand what's going on. We'll talk for a minute about staff productivity. We really understand what a crucial subject this is right now in rural health. We know that you all are struggling and that staffing is just probably your #1 headache each and every day. And as we've said, automating processes and workflows that right now today are manual has many benefits. And specifically in rural hospitals where your staffing is so tight, it really decreases the time that nurses spend on clerical tasks and therefore enabling them to practice at the top of their license, which is so important. It also provides managers with insight into how well their processes are being followed and where potential gaps might exist. So it's all about getting information into the hands of decision makers so that we can understand where changes need to be made. And this is an example if our case management department feels that in order to really optimize our length of stay, get patients moved through the system efficiently and effectively, and to decrease readmissions, it's very, very important to get those admission reviews done within 24 hours so we get our assessments done, we can understand and prioritize our patients. Then we need to understand, okay, that's our program, right? We are gonna make sure that patients are assessed within 24 hours. Well, are those getting done? Is that really happening? Do you know that? Is it that our process is not working, or is it the process just isn't being done like we think it is? And so having an automated system allows you to track that, and you can look and see. And this is just an example. If I'm looking at my admission reviews for inpatients and my observation reviews, I can very quickly see here how many of these reviews are being completed at all, period, and how many of them are being completed within that 24-hour time frame that I have said is so important as the case management leader. I can also drill down into that, and I can see specifically, these are each of my reviewers. I have a very large staff. Don't you wish we had staffs this big? But at the reviewer level, I can understand how many reviews each reviewer has been assigned. I can understand the timeliness with which those reviews were completed. I can also see what percent were completed at all versus those that were not. Versus those that were not, and how many were completed within 24 hours. So it allows me to very quickly draw attention to where I might have an issue, or where I might need to have a conversation, or might need to change our assignments. We might need to change our process, but without visibility into the data, it's really hard to know where changes need to be made. So I realize we've thrown a lot at you, and this might seem really overwhelming, but it is possible to make improvements. A key factor is to identify root causes in your processes that need to be changed, and then having commitment to make those changes. Effectively managing your processes requires transparency and constant communication between many departments. So our goal today was to make you think about things a little differently. We wanted to make you really kind of consider how an automated solution really can help you improve, streamline, and most importantly, that the investment required for an automated solution will be more than offset by the efficiencies and cost savings that you will realize. So we want to say to you, if your organization does not currently have an automated solution for case management, discharge planning, or post-discharge placement, for denials management, or for patient safety and incident reporting, or if you have a solution but it's not providing the data and analytics that you need to understand your processes and to really manage, then now's the time to invest in automation so that you can begin to make positive changes. And those changes you will see are in outcomes, making sure that your patients are being provided with the appropriate resources and services, in productivity of your staff, which is already so, overburdened, in patient safety and patient satisfaction, and also in those financial outcomes. Remember that decreasing denials and maximizing reimbursement. Remember about decreasing the cost of care and decreasing staff overtime, because you are making their workflows more efficient. With that, I'll turn it back to Dana.
Okay, thank you. So some key features when considering an automated solution, you want to make sure that your assessment tool allows you to configure scoring with answers. This is really a big thing, and I'll give you an example. So let's say that you have a question: has your patient been readmitted have 3 or more ER visits within the last 3 months? And the answer is yes. That yes answer can produce a score of 5. And then what if that then will take the whole total score of the assessment and schedule a trigger, an alert, which will put an alert on the patient to say this patient is at risk for readmission. And then it can also schedule a discharge planning or a more in-depth discharge planning review. So making sure your assessment tools have these functionalities in them is imperative. You want to make sure that you're getting the most bang for your buck when you're doing an assessment. It has that automation. The next one, configurable role-specific work list. Again, very important. What's important to have on your work list for you at a glance? Like I talked about, being able to see at a glance on my caseload the number of days the patient has been here, along with the number of days I have gotten approved so far with the insurance company. Okay, make sure that your work list is configurable because you know what you need to see at a glance. Number 3. Discharge planning. If your discharge planning solution sits outside of your EMR, ensure that your system continuously updates EMR with that important discharge information. Not only is it important to meet conditions of participation, but more importantly, so that staff and other members can see on demand what's going on with the discharge or the transitioning of your patient. Okay, the next one, you want to try to have a post-discharge placement solution, the National Provider Database. So I know for a lot of rural hospitals, we already know that we have 1 or 2 or 3 skilled nursing facilities or nursing homes, but let's think about not just post-acute providers, but what about, do you have a database to search for community resources? Which is important. Are there the churches that might help out with some of the patients, giving educational seminars, Meals on Wheels and things like that. So that's one of the things that you want to make sure that if you do have a database, it can also search for community resources, not just post-acute. Automatic faxing. We know that still a lot of organizations still fax, which that might be just the way that some of the facilities want to do, but make sure it's automated within your system or solution, because that allows you to quickly put together documents and to auto fax without you standing in front of a fax machine. Okay. And then last but not least, flexibility you want to make sure your solution has flexibility to roll with the punches. When CMS or your organization makes changes, you want to ensure that you can make changes in your system so that your staff will know what to look for. Like, for instance, when the 2 midnight rule popped up, I was able to quickly go out there and add in that little assessment to make sure we were meeting that. So you want to make sure that you're able to make changes when CMS make changes or your organization make changes without necessarily calling IT or putting in a ticket. Okay, that's the beauty of having a automated system where you're in control. Okay, so that's about all I have.
Okay. At this point, we would welcome your questions. Colleen, have there been any turned in?
Yeah, actually, I have a couple. Thanks so much. First one, can we get a copy of your ROI calculator?
Well, absolutely. At the end of the webinar, you will receive a survey. In the comment area, if you can just state that you would like to be contacted for a free ROI evaluation, we will be sure to get in touch with you. Okay.
Nice. All right. My hospital has a paper screening tool for identifying SDOH. Can that be duplicated in your system?
Deb, you wanna take that
Absolutely.
one?
Yep,
Mhm.
yep, absolutely. As we said, we have examples from customers of all different types of assessment tools that they've put in. In addition, we can build in some of the nationally recognized tools, but absolutely, SDOH is so important right now, and there are some really great tools out there. We have one that we offer as part of our gold standard, but also it certainly can be customized, or if you have one that you prefer, that can definitely be built in. No problem.
Okay, last question I have is, currently we're documenting in the EMR and another system, and they just want to make sure that they understand correctly. If you're saying that documentation in the MorCare system can be pushed to the EMR, eliminating duplication.
Oh, yes, absolutely. And bless your heart, if you are double documenting, we do not want that to happen. You want to make sure that your system can, one, it would avoid the use of your staff double documenting, and this will automate the process to push it back out in the EMR where the doctors and the nurses and most secure staff is at. So having that link is very, very important, and it needs to be updated continuously. So yes, our system, we do allow for that, and really any other system out there should do the same thing. If not, then you need to call us.
Please do. Hard enough to document once, let alone twice. My goodness.
Yes, yes.
Well, I don't have any other questions. Those were fabulous. I do want to thank you, Beth and Dana, for this presentation, and thank you to our attendees for joining us today. As a reminder, you're going to get a link before the end of the day with a recording to this presentation. And as always, our past webinars are also available to view on demand on nrhapartners.com under the Rural Healthcare Learning Center. So before I close this webinar out for everybody, is there anything else you'd like to leave us with, Beth or Dana?
I just think that we want you all to know, you heard Dana and I both come from the hospital environment. Many of our team here at MorCare does come from that background, and we are all so very sympathetic to what's going on out there right now. You all truly are the heroes. You are out there on the front line, fighting the good fight. And in the rural hospitals, I know it's even harder. And you are so appreciated. And please know that how much we value what you're doing. If there's any way we can help you and make this better for you, please don't hesitate to reach out to us. We'd love to hear from you.
Absolutely.
Great. Well, thanks again to everyone. Enjoy the rest of your day. Stay safe and healthy. Bye, y'all.
Thank you so much. Thanks, Colleen.
Thank you. Bye-bye.
Bye-bye.